Honorable seniors, panelists, and dear colleagues. So let's take a start from where Dr. Neelam left that sentence regarding the beauty. While making people beautiful, we should take care of certain don'ts about injectables. Whenever we come across injectables, we see lots of complications as well. Most of the time I try to focus on those things that are practical and we encounter them in our daily clinical practice. Where is the mic, please? I need it. So my today's talk is regarding the complications of injectables in the periocular and perioral areas. While talking about injectables, most of the time we mean about botulinum toxin and fillers, although other injectables are also performed in the same areas, like mesotherapy and certain other things. So while talking about botulinum toxin, it brings about disfigurement, temporary disfigurement and transient disfigurement regarding the relaxation of muscles. While when we talk about dermal fillers, then the results, the complications might be drastic. They might be minimal and drastic as well. So let's get a start from the facial anatomy. Everybody is familiar with the common muscles that we target while injecting botulinum toxin, the orbicularis, oculi, and all of them. So let's not waste time. Here you can see a complication in this patient, and you can see the left eyelid ptosis has happened. It's because of the wrong placement of the botulinum toxin or the diffusion inside the levator palpebrae superioris muscle. Another patient in this picture, you can see a Spock bro. Spock is a character in Star Wars movies. So you can see this character over here as well. A little placement of botulinum toxin or under treatment of the lateral brow on the right side, lateral forehead. Similarly, the diffusion inside the rectus may lead to diplopia in this case. Now I would like to ask what has happened over here, if anybody can tell what has happened in this case. Which side is affected and which side is normal? Anybody please? The right is normal or the left is normal? Somebody is saying the left is normal. If I disagree then? If I disagree with that as well then? You have to say what has happened over here. Which muscle is wrongly targeted in this case? It's clearly mentioned while they are doing the botulinum toxin to relax the depressor anguli oris muscle, and Botox has been wrongly placed in another area, and that is depressor labii inferioris.
और 100% attention. चलो भाई.
So while targeting this area, especially the depressor anguli oris muscle, you have to keep in mind other muscles of the nearby area as well, like elevator anguli oris, like depressor labii inferioris, and risorius, and all other muscles. Otherwise, instead of making people beautiful, you may make your career ugly. So let's see. The patient's left side is affected in this case. In the muscle, depressor labii inferioris over the left is affected. So what has happened? Can anybody say why the face is elevated over the right and depressed over the left? Basically, there is antagonistic mechanism between muscles. Just like whenever I inject Botox, I counsel the patient and tell like what am I going to do is temporary relaxation of one muscle and the pulling of contralateral pulling over the other side. So this is what happens. Similarly, over here, there is a wrong placement of botulinum toxin in the zygomaticus major over the right side. That is relaxed zygomaticus major and resulted into the depression of the angle of the mouth over the right. So regarding complications, there might be early and late. One is very common. 3 E's, erythema, ecchymosis, and edema. They are the most common complications encountered while injecting fillers. It's a hematoma formation due to intravascular like leakage of blood from the vessels in this tissue. I'll show you a case that has ecchymosis, that has overfilled area, and that has infection. Almost one case contains all of these things. So in this case, an infection is shown. Similarly, biofilms. This is the most commonly encountered problem I have seen, the Tyndall effect. That is the bluish hue in the infraorbital area due to wrong placement of superficial placement of. I can leave the stage if you want. So this is very important slide. Even people from different cities, they travel to other cities, even other countries, when they suffer this issue and trying to get an expert one. So too much superficial placement in this case has caused this Tyndall effect. So how to manage this case? Either gently massage it, inject hyaluronidase. If you don't have hyaluronidase, timely you can just do microneedle RF in that area, or you can do incision and drainage. This is a patient who visited me, a quack, probably somebody, whoever. He did too much wrong in this case. Over-treated this area, didn't take care of the like hygiene and sterilization. So everything happened to this poor patient. What happened, you can see it. He had abscess formation in this area, as well as too much of a filler, and it was not even known what sort of filler it is. So I had to infiltrate this area with hyaluronidase at first, and then after a few days, when I again checked it, there was a huge pus in it, so I had to drain it as well, and then surgically corrected it. Nodules, you may encounter these. You can press them, or slightly you can inject hyaluronidase in this case. Similarly, lip nodules, and you can have these granulomas formation. So intralesional steroids, sometimes oral one, along with surgical incision may treat it. This scarring is very common. So summary, what should we do is like to avoid the non-ischemic complications, just avoid blood thinner medication 2 weeks prior to injection. What's the reason behind it? Like platelets, life is maximum, it's 10 days. So if you would ask the patient to stop taking aspirin at least 10 days before this procedure, it will help you a lot. Similarly, numbing cream with vasoconstrictors, cool compression will solve this transient edema and bruising as well. Contour abnormalities, it's mentioned over there. You have to inject below the orbicularis oculi. You have to be just above the bone in this area, in small amount. Always try to undercorrect this area. Never ever try to overcorrect this infraorbital area. The reason is hyaluronic acid is hydrophilic molecule. It absorbs water. So whatever the amount you inject, it increases the size. After a few days, it swells up after absorption of water content of the skin of the patient. So you don't get the results you want then. Similarly, inflammatory reactions and infections in something. Now regarding the vascular complications of injectables, You have to know the anatomy of the facial artery, its path, and all the course, and the very important areas, the danger zones. These are certain tributaries and other important facial arteries other than, yeah. So the glandular area, temporal area, piriform fossa, and nasal vessels. Ischemic complications, they, after embolization, the damage might be more than the area you injected. You can check over here the signs of ischemia. What happens at first is the whitening, the blanching, the blue mottling that results into a larger bruise. You see it, and then what can you do? You can see the ultrasonic picture in this case. What has happened is the vessel after just before the vascular area, just before the occlusion is more dilated. On ultrasound you can see it. So the techniques to avoid the ischemic complication is always try to use local anesthetics with epinephrine, try to inject less volumes, aspirate first. I have listened from experts all around. They say like even if you aspirate for more than 10 seconds or even more than that, you may not be safe, but better to be on the safer side. Nothing is safe even after following all of these precautions. So blunt cannulas, try to use it, and always try to feel the tip of your cannula while targeting the infraorbital area. You may hit the orbit, you may hit the globe. If somebody can have this device, this infrared device, while injecting the very important areas, the danger zones, this is called AccuVein. That's infrared device that absorbs the hemoglobin inside the vessels, absorbs the infrared light, and the vessels are visible. So if it is available, it's a good thing. So general management, aspirin, warm compression, nitroglycerin paste, oral, everything is shown. Now how to inject hyaluronidase? It's a big issue. You have to inject hyaluronidase for the correction, like the dose is different, while having an emergency situation. If you have a vascular occlusion, then the dose is, then you don't obey the dose. You have just to infiltrate that area subcutaneously as well as intravascularly. So the dosage, it comes in a vial of 1500 international units. You just prepare it in 10 ml of normal saline. So 1 ml contains 150 international units. And then you have to just infiltrate this area, surrounding area, as well as the vessels. In this case, it was injected both intraarterially as well as subcutaneously. The hyaluronidase was injected in that way. Now you will ask, how can you inject intraarterially? If you have ultrasound, so ultrasound guided, you can do that. Sir, I am specifically talking about intravascularly. Yeah, they have to inject it, and they have to flood that area, but if they want to be precise, they can do that as well. So the visual complications are drastic. Excuse me. Sir, we'll discuss it. I'll just mention one important thing. 1/5 of the people are very safe in this case. Even after they hit the retinal artery, they are safe. Because in that case, the congenital anomalies that makes you safe. So this is the last slide, and how to you avoid. This is very rude, Dr. Sherwanu. As usual, you do this. I think you should learn some etiquettes. So, sir, this thing is very important. Like all of these people, most of them, they are youngsters. They encounter these things a lot. Sir, it's more important than slimming drips, I think. It's more important than those things that do not create maximum change and things like that.